can say the is it the quality or the what I'm driving at is to say there are some people who are more important than others. Right? Okay? Yeah, so therefore, because of the importance, yes, the importance of that person, the family will decide which is okay drama to get that way this person gets access to healthcare, right? Irrespective of the price that is attached. So we are looking at when one is sick and they require healthcare, right? Yes. Is that making sense? Yes. Several of the most important prices are determined by the nature of the investment in health by few big players in the health system, such as the government, the insurance companies, and pharmaceutical companies. So the prices, we are saying that they are determined by the investment in health, right? The prices, for example, of delivering cesarean section, right? Because it is within a lot of policies in underdeveloped countries to ensure good maternal health, right? The government sort of sets a standard of prices in regards to cesarean section. That way, individuals who can pay in private hospital can also access if they because my government hospital sometimes they are full and so on, right? And hospital charges for different types of surgeries, knowing the charges do not necessarily reveal the true price to a customer because they may not include all the costs of other inputs. Sometimes an unfortunate things happen. So we gave an example of an estimate of saying you are going through surgery. Like let's say it is a section. So we are making that estimate on the best possible outcome. You go into surgery, the doctor performs the surgery, the baby comes out, no complication, right? But what if you have made that estimate, but then a complication happens? Maybe the woman starts to bleed, mwana ujobezona woody, you know, woody muntu has been with no oxygen, they turn blue, eh? Yeah, so mwana uja has come out and the baby is blue, they need oxygen. Amaya just afunika. Pama jitika tuma complications body within a space of 15 minutes. What has happened, right? So we are saying that in regards to there's other inputs to healthcare, right? That may not be may not be highlighted in the cost estimates. Sometimes one has into zingono, for example, akuiga drip, right? So in the private setting, right? If the nurse is there to put you a drip, chijama ikakanyula ngati aphonya pa estimate ikaimuzi because they are assuming unoda nisaja ayapanga kamuzi nkamuzi koma ngati ataphonye katatu makanyula atatu onse aja sinde kuti akuchaja iwe ngati mankhwala ngati mankhwala where do you think that cost is going to go to? That's what happens. Kama mankhwala anesa kupanga draw and then mankhwala ajatayika, it has to be charged to the patient. So you are looking at things. There are a lot of things that can happen. Yeah. So these are some things that can, elevate the prices. And the key characteristic of healthcare is that demand is relatively inelastic. And research has found that while the decision to use or not use public facilities was affected by the price of private healthcare. So the decision of whether to use or not to use public facilities is affected by the price of healthcare. So you are looking at the user fee can generate substantial revenue, but demand becomes sensitive to prices changes in as income falls. So there are two factors there, right? The price of private healthcare. My private healthcare facility and they have good prices, right? Which sort of reduces the demand of that particular health service in the government hospital, right? That's the second thing. And the second thing, that's the first thing. The second thing is the sensitivity of price with changes in income falls, right? So healthcare services can be provided for or they can be demanded, but then it also is affected by the income of individuals. For example, right now with devaluation, ile ndama nthakulandira yomweyo kumano ndama imene yoyo the amount what you can purchase with that money yakanga is no longer, yes, it has reduced, right? So if a person could access a good healthcare service at 15,000 yomweja, it's only providing only a fraction of that healthcare service, right? So I'm giving that an example as not really, not necessarily within income force, but because of the strength or the strength of the currency of Malawi. So this implies that user fees would proportionately reduce poor's access to healthcare more than the rich, because they are looking at the money that, when you're looking at the element of budgeting it, umakhola unazolewa na kuti bread in 1000 was. And for you to say wavule bread 2500, even after 5 years umaona zizovuta kwambi. There are some people even mazira anasiya kudya because they look mazira singagule mazira 70 basi sitizija mazira ndizigula mazira ndikafuna limozi ndikagula limero, right? So this is within people who generally don't have that enough income, right? So for a person to budget like that, it means they don't have enough income, as opposed to an individual who, generally even when they are getting access to something, they don't really look at the bill, they just sign card. You've seen people like that, right? They don't really care as long as you've given them the satisfactory service, eh? to the nearest 100 watch. So aside from reducing the net price of healthcare, insurance may be viewed as a method of financing the demand for healthcare. It is very true. In the aspect that we are in right now, there's a lot of healthcare insurance. Mazimbali ina akumaichula Econo Plan. Have you heard of it? Econo Plan, yes, like Econo Plan, where I think you pay, if I'm not mistaken, 2,500 per month. So you're looking at that. That's a very reasonable price, and you can access. Huh? Yes, but then when you're looking at how much you pay, okay, example would be if you pay 2,500 every month, a year is 25,000, right? So you have, like most of the times under 5 children, so you are paying that amount and you access a clinic or a small private hospital that has Mazim, right? With that 2,500, right? They will give you which 25,000 would have costed you more than 25,000 if you were, to access that healthcare on cash, right? And it only reduces the cost of care and also increases the family's ability to secure health services. So this is the principle that a lot of medical aid insurances right now are using. Therefore, health insurance is expected to raise the utilization and expenditure in health care. That is 25,000. We got 250,000, they have 300,000 a year. It's 300,000 a year. But then when you're looking at the healthcare that you access, it's significantly more than that 300,000 that you are paying for in that year. Any questions? Okay. So we look at the sex discrimination. Sorry. Aside from reducing, however, in places like the United States, health insurance structures has been a significant factor in increasing the healthcare costs. While here it has reduced the healthcare costs, in countries like the US, it has ballooned the healthcare costs without the expected increase in healthcare outcomes. Healthcare insurance has just caused hospitals to attach higher prices to the cost of things, right? So even although with the assumption with underdeveloped countries that normally people who have healthcare insurance, they access healthcare services and they are most likely to have good positive outcomes. The services are usually of higher quality. In the United States, it has become a controversial issue because there are a lot of healthcare insurances, but most of the healthcare, many of those healthcare insurances, some of them also own pharmaceuticals, right? And then they are just increasing the prices of things, right? But it's not, their policies are not stipulated towards improving patient outcome. They are just driven towards just making profit from themselves. If you look at a lot of reviews in healthcare insurance in the United States, it is like that, where a lot of patients complain on the fact that many of the times you have a healthcare insurance policy, you go to the hospital, no, your healthcare insurance policy does not cover that. Yet, EMUNA does not cover this. And on top of that, you are looking at the cost of all the services that you provide. That cost has become even higher because we are looking at that price margin, the price maximum, where panado emwe uja amwiga panado esendora lipa 2,000 pano, right? Yes. So it's more of just increasing profit margins for companies. So in the presence of children and elderly persons in a family, that raises the frequency of illness, right? You know, VIP, Mazim, pali VIO, VIP, VIO, so it is one of the highest insurance policies with Mazim, but then you pay a lot of money when you're older. Because normally people who are older, they get sick a lot more, right? And the amount that they spend in the hospital is also a lot more. And that is the same with people who are younger, right? So sex discrimination is actually the major underlying reason for expected differences in health service usage by men and women. So in many societies, that the perception that women have low economic value in the households lead to their low use of healthcare services. But that is true in developed countries as opposed to underdeveloped countries. In underdeveloped countries, there's a lot of resources that go into women's health. Yes. You look at Malawi, a lot of resources have gone into improving sexual reproductive health, maternal health, and so on. So it's more of either or, it depends on the context which you are talking about. In many societies, however, women are more likely to regularly go to the doctor or go to doctors when they have a problem, as opposed to the investment made by the government. So this phenomenon often used to explain why single women in many parts of the world have higher life expectancy than married women. Do we understand that concept? Single women all across the world, in many parts of the world, have got a higher life expectancy than married women. Satish is saying, oh yes. The reason is the rights-based system in many countries is driven towards the male making those decisions to hospital attendants, firstly. And second, because they're married, it means they have a lot of responsibility in the household. Right? As opposed to a person who ukasi ya nyumba musa kwanza because they're trying to access healthcare because they really are not they don't have those domestic responsibilities. In the same vein, within families, the mother's education is crucial because it usually supervises the household. An individual's health knowledge and beliefs affect their efficiency in maintaining personal health through diet, hygiene, and preventive measures. This is an important factor with the example that you gave, right? We are saying Kuti, an individual's health knowledge and belief system affects efficiency, right? So the difference between developing and underdeveloped countries, or developed and underdeveloped countries, is that people in underdeveloped countries generally are not interested or they don't have knowledge on health issues, right? So this also affects the outcome of an illness. Zimene zinachitika zidachitika mtawuni munomo amayi wadakazindikira nsanga, you know it. Yes, than kumudzi kokuti sinanga they're not exposed to a lot of things. And a clean environment and quality healthcare services, medical equipment for diagnosis, treatment in healthcare facilities are all necessary when you are looking at provision of healthcare services. Any questions? So finally, we are going to look at the health investment. So health investment is where being healthy rather than being sick is everyone's preference, right? If you are sick, it means the program bank. Investing in health system is does not only save lives, it is also crucial in investing in the wider economy, because we have highlighted or we have pointed out the fact that healthy people are the ones that are most productive, right? There has been strong political and historical commitment to treating health as a social goal, either through legislation, mandating and prioritizing expenditure on health. That is very apparent in Malawi, right? When you're looking at ukaona budget ya Malawi ndama zimene zimapita ku Ministry of Health, kumakhala ndithu budget yokwanira. Mwina zimangovuta because of the corruption, ndonna kuti amangogulisana makampani okhawo kazinthu ngazimenezo. But there's a lot of money that goes in. And on top of that, there are a lot of agencies that, pump in funds into the Ministry of Health. So, for instance, the government of Brazil, Costa Rica, and Thailand have established social security and health insurance systems for the entire population to ensure that they have access to healthcare properly. And actually, the government of Malawi has done that to ensure that all government employees are on medical aid. Do you know that? Panova, all government employees are going to be on massive. So yes, all government employees. Which is a good thing. Yes, they're going to be on Mazim, all of them. So a person will choose. So the government is going to be contributing 90% of the medical insurance, and the person is contributing 10%. Which is good, because they're trying to reduce the load on public hospitals, Yeah. Yes. Because there's a lot of load in the public hospitals where some government employees and their DC, a DC abita chipata chabuma. Mazone, abito meuja, pepa neto mankha kulibe. Yes, it can happen. So, because it's not medical insurance, you're looking at generally, it's not like those people, they receive a lot of money, You know that, They just have other benefits, like a meeting and so on. So, they're looking at getting access of healthcare in a private institution. But this has enabled people who are in government offices to at least access good healthcare because of the health insurance. So investment in health increases the total amount of time available for production of goods and services. So it's true. Ndikungoti ndingodwala ineyo sinde kuti basi ndoti nuso simphunzira ndoti ndingodwala kamwezi bwa ndoti basi the productivity, so it's affecting two people there, right? Yes. And the extent to which individuals choose to alter the consumption of health inputs depends on factors such as price, income, and preferences. So individuals will invest in their health if they have access to available health inputs. So these available health inputs include things such as nutrition, right? They have access to information and so on. So stakeholders should make facilities available and accessible to employees of health investment. Government should introduce pro-poor health programs to make healthcare accessible to also the low-income employees. So that is what I've said, the medical insurance that the government has done. And firms should establish clinics at their workplaces to provide primary health care services. That is true. Do we have a clinic here? No. Is she a nurse? Who is she? Oh, you mean the admin assistant? Isn't that her name? I thought her name is Marita. Oh. Okay. No. Okay, fine. But the point that I'm driving at here is that institutions need to invest in the health of their employees. So you find like Reserve Bank has got ESCOM, national banks don't really have, but then they allow for healthcare services to be provided, right? So that's why they provide health insurance, because sometimes they might not have the actual person, but then they provide health insurance. So that is ensuring kuti muntu asafike podwala kunoti sakugwira ntchito yake. It affects the company and it also affects the individual. And according to the statistics, it is found that in 2004, the mortality rate in the United States for people ages between 15 to 24 was about 80 out of 100,000. So this represents 0.08%. In the contrast, the mortality rate of those over the age of 85 was 13,823 out of 100,000, right? So that represents 13.8%. You find that over the age of 85, right? It's okay, right? Yes. So if those deaths are 13%, they are not something that is very alarming, right? As opposed to either 13% in it was people between the ages of 15 to 24. You are agreeing that people in their order, they have reached the age where at least we celebrate their life, right? Yes. It's true. Of course, in an African perspective, and hamagagamira mo, right? Sungama yakwezi ngazimezo. But white people, they are like, what? I've had my life. I've enjoyed myself. Me. And it is not surprising that mortality rate increases with age, right? Because my dad says it, utankani. When something is expiring, it, yeah. So that's what he says. Every time he's sick, I'm like, I'm in a banji. He's like, I'm in a utankani to us. He's saying that with age. So providing that young people, utankani. Yes, providing that young people have lower probability of dying than older people. And subsequently, infants are sometimes exceptional because normally between the ages of 0 to 6, children are more likely to die than at 18 months. Yes. So there are many behaviors that predictably affect the likelihood of dying. Diet, exercise, risky behavior, right? Which includes everything from unprotected sex to skydiving, affect mortality rates as well. Kumano, when you are looking at risky behavior, no sima mona waita ni awina wagama mkaya kumamu wafu suta fumu ana somebody do, somebody kuma banji they are still alive, so it's either or, it depends on genetic scientists are saying that it depends on the genetics. There are some people, what I call it, they are in the most favorable environment. Their genetics do not allow them to live up to a certain age. Yeah. So healthcare, which reduces mortality, however, also raises the output for workers in a nation by increasing the vitality of these workers. So many diseases with high prevalence rates in underdeveloped nations, diseases such as malaria, trachoma, schistosomiasis, bilharzia, many of which we might discuss them later on in this course, estimate that less than 20% rise in productivity per week over 75-year period. So the percentage is equivalent to less than a quarter of the 1% rise in productivity per annum. So a less than 20% rise in productivity over a 70-year period would compensate for the combined effects: A, the larger number of births due to increased number of childbearing ages, right? And increased proportion of dependents in the population. You see that an increased percentage of dependents in the population is not good for the economy, right? Yes. It puts strain on those who are economically active. And when you are looking at the government ability to collect tax, it means they are only collecting tax from a fewer people. And we highlighted that it also increased. Was I talking about this class? When I said, Kuti, when there are a larger amount of dependents, it increases the government spending on healthcare and childcare. It's not this class, Okay. And yes, the increased investment in physical capital goods require maintaining a constant ratio of marginal capital to the workers. So these are the elements when you are looking at the percentage of people in regards to mortality rate and disease prevalences. And finally, being healthy also means that you can work and earn wages. One of the causes of poor health is lost days at work. So, antamina malandila per day. It means una udintama imeni sarandila, right? This is a cost, and not only to the individual but also to the society as a whole. The economy's population is producing less output. So when in poor health, one risks losing wages for the days when you cannot come to work, and many employers provide insurance for these lost wages through provision of sick days. So that statement is talking about people who are permanently employed. That sana saini siku mimi ndio sana run, they are not going to get paid. Yes, but people who are on a contract or people who are permanently employed, mu contract mujama kama 6 days where they can still pay you even although you didn't come. So this becomes controversial when you're looking at a person who has been sick for a very long time. Muna wadwa 4 months. I remember I had the experience of an employee who was sick for over 5 months. So there are some policies where if you have not been attending work for okay, in the government, I think 3 months you receive full pay. After 3 months you start to receive half. And after 6, yes, after 6 months I think ama kukanga ama ngokuyimika koni moma sokuthi sama ujosa ama ngokudani ama ngokuyimika until you get better and you come back to work. Yeah, but in a lot of private institutions I think after 1 month, yeah, after 1 month ama kulipira mwezi ngati wadwala unless it's maternity leave, and then after the second month they give you half. The third month, if you don't report or whatever, I think they just terminate you. Yeah, so normally mugamaza yamba nchito muzaona ma contract, yeah, yes, it's the 3 months, yes. 3 months every 2 years. Yeah, it's 3 months every 2 years, so if you get pregnant again within the 2 years, they don't give you maternity leave. Kuyazakhala ngobya nchilosa kubilika sitiza kubilika nini. So we are saying that many employers provide that insurance. So private employers sometimes offer different disability insurance as part of their compensation package and can also purchase insurance directly from an insurance company. So in today's lesson, we have looked at the healthcare demand, right? Focusing on the variables that affect the prices of demand, right? What have we looked at? These variables? Oh, variables that affect prices of demand, leadership, demand, supply, composition of journey, cost of what? Compensation. Yes, cost shifting and compensation. Yes. Ndekuti simamva. It's not okay, yeah. So we are looking at the variables that affect. So it's the price, it's the supply, the demand, compensation, and the cost shifting, right? And then we're looking at the factors, the other variables that affect the quality of healthcare, right? Yes, yes, yes. The professional skills, right? Yes, those are the factors that we've discussed. So the key factors there in healthcare demand are the variables that affect price, right? That we have highlighted previously. And then the factors that affect the quality of healthcare, which include the skills of the profession, right? Yes. The leadership, okay? Any question? Okay, so in the next lesson, we'll be looking at healthcare supply. Right? Well, you see the content, okay? The content is a lot. So, mungamabwera muje does the zone situ kufunzira mu kwanene.